Most patients try and do this one thing, but doing this can make it easier for your doctor to make a mistake or be guided down the wrong path. And this happens all the time. I see it constantly every day when I'm working. It's patients that lead with a diagnosis. So I'm Dr. Matthew Gloudeman. I've worked as a doctor for nearly a decade, from pediatrics to palliative care and in so many different specialties in between. And in this video, I'm going to walk you through why leading with a diagnosis is such a problem. I'll give you a tangible example of how this can actually go wrong, and I'll tell you at the end what to do instead. So why is leading with a diagnosis a problem? You're automatically biasing your doctor, unintentionally. So we are pattern recognition specialists, experts. We understand different disease patterns and we trying to pick those out and then also rule out worrying symptoms. So if you lead with a diagnosis, you're biasing us into thinking, is it that or not? And that narrows our way of thinking. So you have to almost walk back patients. And what I do is I say, like, I appreciate that's what you think, but can you just walk me back? Tell me what's actually happening. What are the symptoms? What's going on? So that's how I get patients out of that quickly, but not every doctor will do that. So I'll give you a tangible example. Imagine a patient comes to me and they say, doctor, I think I have a UTI. I've had this before. I just want some antibiotics. So you're trying to have a transactional interaction. You've had symptoms similar to this in the past, and you're asking me, can you have some antibiotics? Now, where this goes wrong is if I'm just thinking without actually asking any questions, and maybe, I know that patient or I'm familiar with them. We as doctors, we're busy people and we're trying to get through our workload quickly. And if we don't take the time to rewind back a little bit, sometimes you can miss something unintentionally. So if someone presents to me like that, I will walk them back. But some clinicians may say, yeah, it's a sensible person. They've had this before. Let's give them some antibiotics. And it actually might be that you're having some worrying symptoms that maybe that doctor didn't ask you about. So they might be asking, are you having blood? Are you having weight loss? Are you having any problems with back pain? That might mean that there's something different going on that's causing a UTI and presenting in a similar way than you've had it before. And if we don't walk you back from that diagnosis you think is going on, then we could miss something potentially serious or a recurring problem like a kidney stone, or a recurring problem like something more serious like cancer, things like that. So I appreciate you trying to help your doctor, but if you do this, know that you might unintentionally be biasing them, and it might lead to a poorer outcome. So what should you do instead? I usually tell my patients, lead with your symptoms. Tell me what's been going on. You know your body better than I ever will. You're going to be able to explain what's actually going on. And that's where we get to kind of understand the story from your perspective. We want to know the duration, the progression of symptoms, and then let your doctor ask targeted specific questions, because those questions are critical for them to rule in and out different worrying situations, different worrying disease patterns. And that's what we're trying to do if we aren't biased automatically by, is this a UTI or not? So that's how I have my patients explain things. I've made a separate video about 5 tips you can use. And the key other point is, if you're worried about something specific, like you're worried about cancer, you're worried about kidney stones, you're worried about a UTI, say that at the end. Let the doctor do their job, you do your job, and then at the end say, look, I'm worried about, is it a UTI again? Or I'm worried, is it something more serious? Or I've got this family history. Can you tell me what you think about this particular problem? So take that to the end of the consultation, so you're not biasing your doctor in the beginning unintentionally. I'm not saying you're doing this purposely. So what I really mean when I'm trying to explain all this is, your job as a patient at the end of the day is to tell us the story of what's happening medically from your perspective. Our job is to figure out what that story means. So I hope this video helps you.